Emphysema is a disease that gradually damages the air sacs known as alveoli in the lungs. It is one of the several diseases known collectively as chronic obstructive pulmonary diseases, or COPD. In emphysema, the alveoli lose their elasticity, which impacts their ability to stretch and shrink. Over time, this eventually causes the alveoli to burst.
A 52-year-old male named Simon has come into the clinic complaining of shortness of breath and fatigue. Upon taking a detailed health history, the nurse discovers that Simon has been smoking a pack of cigarettes a day for the past 30 years. The nurse takes note of all of Simon's symptoms and then orders a chest x-ray and a CT scan. Upon viewing the results, the physician determines that Simon has emphysema. Risk factors. Risk factors for emphysema include smoking tobacco or marijuana, exposure to indoor and outdoor pollution such as manufacturing fumes, occupational exposure to fumes or dust. People often start to experience symptoms of the disease between the ages of 40 and 60, or there is a rare risk factor where people are lacking the alpha-1 antitrypsin gene.
Normal physiology. Emphysema affects the respiratory system in the human body. In general, the respiratory system is composed of the lungs and trachea. The trachea divides to form the right and left main bronchi. Once inside the lungs, each main bronchus subdivides further into bronchioles. The respiratory bronchioles lead into alveolar sacs, which contain thin-walled sacs called alveoli, that have alveolar ducts whose walls consist of diffusely arranged rings of smooth muscle cells and connective tissue. The walls of the alveoli are made of a single layer of simple squamous epithelium, and these are called type 1 alveolar cells. The capillary and alveolar walls, along with their basement membrane, form the respiratory membrane, which is a blood-air barrier that has blood flowing past on one side and gas on the other. Gas exchange happens readily by simple diffusion across the respiratory membrane. Oxygen passes from the alveolus into the blood, and carbon dioxide leaves the blood to enter the gas-filled alveolus. The respiratory system also controls pH by regulating the amount of acid or base in the body. It eliminates carbon dioxide and acid from the blood while replenishing its supply of oxygen. Carbon dioxide generated by cellular respiration enters erythrocytes in circulation and is converted into bicarbonate ions for transport in the plasma. Healthy individuals expel carbon dioxide from the lungs at the same rate it is formed in the tissues. Type 2 alveolar cells are composed of simple cuboidal epithelium and secrete a fluid-containing surfactant that coats the gas-exposed alveolar surfaces, as well as secreting a number of antimicrobial proteins that are important elements of innate immunity.
Symptoms. The main symptom of emphysema is shortness of breath, which starts out when an individual is doing physical activities, but once the disease has progressed, shortness of breath can occur even at rest. Other symptoms include fingers or lips turning blue or gray and decreased mental alertness. Pathophysiology. Once innate respiratory defenses of the lungs' epithelial cell barrier and mucosal transport system are infiltrated by foreign antigens such as noxious cigarette ingredients, the responding inflammatory immune cells, including eosinophils, macrophages, and T lymphocytes, transport the antigens to the bronchiole-associated lymphatic tissue layer. It is here where the majority of the release of neutrophilic chemotactic factors is thought to occur. Proteolytic enzymes, like MMPs, are mainly released by macrophages, which lead to the destruction of the lungs' epithelial barrier. This also leads to symptoms such as shortness of breath because of the loss of elasticity in the alveolar walls, decreased mental alertness because of lack of oxygen intake to deliver to the brain, and finger or lips turning blue also because of the lack of oxygen intake. Due to the fact that the alveoli have lost elasticity, when somebody with emphysema exhales, carbon dioxide gets trapped inside. Along with leaving less room for oxygen-rich air to come into the body, this causes something called respiratory acidosis. Respiratory acidosis is a medical emergency in which decreased ventilation increases the concentration of carbon dioxide in the blood, which then increases the carbonic acid levels and decreases the blood's pH. Treatments. There is no cure for emphysema other than a lung transplant. However, emphysema treatments can improve some of the symptoms and preserve lung function. An example of this is an inhaled bronchodilator such as albuterol, which relaxes and opens the airways. Some long-acting beta-agonist bronchodilator medications include formoterol and salmeterol. These medications may be available as inhalers or as a solution. Simon is prescribed a bronchodilator in the form of an inhaler, which will help ease his symptoms and give him a better quality of life.
Key concepts. Emphysema affects homeostasis in the body because of the decreased amount of oxygen-enriched air reaching the bloodstream. Without oxygen, the body isn't able to carry out normal physiological functions such as producing ATP because the cell needs oxygen to carry out chemical reactions needed in producing energy. Type 2 alveolar cells produce antimicrobial proteins that are an important part of the innate immune system. So if the type 2 alveolar cells are damaged through emphysema, there is less of the antimicrobial proteins produced, making the body more susceptible to illness. With the lack of oxygen coming into the body, not enough oxygen is being transported across the cell membrane into cells to generate enough ATP to fuel the body.